Hi, this is Dr. Barron with High Point Spine and Joint Center. I wanted to make a quick video recapping your diagnosis of TMJD, which is temporal mandibular joint disorder, as well as letting you know some of the options for treatment we can do in the office and in the clinic here, and some of the things that you can do on your own to help at home. So, temporal mandibular joint disorders are characterized by pain that arises in the TMJ, which is the joint right in front of your ear canal, and it's where the jaw hooks into the base of that skull. And usually it's caused by imbalances in some of the muscles of mastication or chewing, and also how those muscles attach into your skull and affect the upper neck or the cervical spine. Oftentimes we will find restrictions in the upper neck that are creating some of these balances in that TMJ joint. So most patients who get this are between 20 and 50 years old, so it's usually a little bit of a younger crowd. It's 2 to 3 times more likely in women, and it's usually characterized by the pain in the TMJ, as well as maybe some clicking, some muscles that are snapping when you chew, limited movement in your mouth, so the mouth may not be able to open as wide, or some people it's even stuck open and they can't close their mouth. Eating usually makes this worse, so chewing food can make it progress and make you have a little bit more pain. There's usually an ache in that ear canal, and oftentimes, like I said, it can refer pain to your face, can refer pain down into your shoulders or into your neck. It's definitely more common in people who grind their teeth at night or clench their jaw at night, so that's something to consider as well. What we do in the office to treat this, there's lots of different options. It usually involves some sort of joint manipulation, especially assessing the upper neck and how that affects that whole TMJ joint into the jaw. They're intimately related, and so oftentimes restrictions in the upper neck or the upper cervical spine influence this temporal mandibular joint. And so we'll definitely check the mechanics of that and adjust as needed there, as well as adjusting the jaw itself. There's also some myofascial things that we can give you to do to some of these muscles of mastication, the big masseter muscle here, some of the muscles inside the jaw that can help alleviate some of this pain for you. Sometimes we'll look at dry needling the muscles in the neck or around the TMJ joint. That involves inserting a thin monofilament needle into the muscle, running a current through it that makes that muscle fire. It helps it to reset and helps it to relax. So that can be beneficial as well. But there's a lot of things that you can do on your own at home as well. The big thing is avoiding chewing bubble gum. You want to avoid chewy, rubbery foods or foods that make you open your mouth too large, like let's say eating a big burger. Those types of foods can make it more painful. You'll want to eat soft foods. You'll want to make sure that your foods are cut up small so you can take small bites. Sometimes we'll give you some exercises that will help to massage some of these muscles of mastication, and that can help you heal up as well. Ice is helpful. Usually I tell people 15-20 minutes of ice on the outside of the jaw joint as well as on the inside. Taking like a small piece of ice and sucking on it on that side of your cheek can help reduce some of the swelling and some of the pain in that area. Some patients do get some relief with getting a custom fitted mouth guard, and so that can help as well. There's some that you can do on your own from some of the big box retailers, but as well as a dental provider can help you with that as well. So I hope this finds you doing well. We'll see you at your next visit. Let us know if you have any problems or have any questions. Feel free to text us. Thank you very much and have a good day.